Hi, welcome to Colorectal Cancer Canada's Tush Talks. Colorectal Cancer Canada is the nation's leading colorectal cancer patient group, and Tush Talks are our educational interview series where we provide information to you, patient, caregiver, friend, family of a person with colorectal cancer about topics related to treatment and care and prevention of colorectal cancer in Canada. My name is Carl Bindman. I'm your host, and today we are joined by Munaza Jamil to talk about health equity in clinical trials. Munaza has 24 years of experience in the world of clinical trials. She's passionate about equity, diversity, and inclusion, and integrating these principles across all her work. Her special focus is the inclusion of immigrants in clinical trials. Munaza's work experience includes leadership roles at several excellent healthcare institutions, overseeing large, complex teams, facilitating the startup, execution, and closeout of clinical research projects in multiple therapeutic areas. She is on faculty at McMaster University, where she teaches in the Applied Clinical Research Program. She also chairs the N2 Public Engagement Committee, where she champions many EDI initiatives. She has recently authored an important course on cultural competency in clinical research, which is the first of its kind in Canada, specifically designed for clinical research professionals. Munaza, it is obvious to say that we are very happy to have you talk about this topic. But first, how are you doing this morning?
I'm doing well, and thank you so much for having me. It's a pleasure.
It's our pleasure. Shall we jump right in?
Sure.
All right. Let's talk maybe about some groundwork about equitable access to clinical trials. So, can you explain briefly, for people who may not know, what a clinical trial is?
Yeah, absolutely. So, clinical trials are research studies that are testing new medical treatments, drugs, devices, interventions, etc., in people to determine how safe and effective they might be. And there's a common myth out there that you have to be sick in order to participate in a clinical trial, or clinical trials are only for patients or those who are suffering from illness or disease conditions. But while that is true for sure, but clinical trials are also, there's many trials out there that are also taking in healthy volunteers. So there are clinical trials for everyone. And clinical trials are really important because not only do they progress scientific knowledge and medical science, but they also improve the safety and quality of patient care. So very, very important.
Yeah, how do they do that?
So the findings that you have, the results from the clinical trials that come out will inform practice. It may inform healthcare practice, nursing practice, all kinds of things that are happening right now might change. The way that you do some very basic procedures might change just based on research that's been done, and then that would ultimately improve the quality of patient care, the safety of those procedures, and ultimately then that's going to contribute to better health outcomes for everybody.
So if I understand, clinical trials aren't necessarily like to access the most advanced and groundbreaking medication, which I mean, it could also be, but also just generally improving healthcare across the board.
They can be about anything. They can be about new treatments, like I said, new interventions, new way of doing things, testing new devices, and drugs as well.
Great. We'll come back around to that. But first, maybe you could tell me a little bit about what health equity means in your work and in Canada.
Yeah, so basically, if you just talk about it in layman's terms, the concept of health equity is basically no matter who you are and no matter where you come from, that you have the opportunity to access and benefit from the the best healthcare services, and you have the opportunity to achieve the best level of health for yourself. And so we know that there are many groups of people, many populations that do not achieve health equity, that don't have health equity. These individuals might be new immigrants, those people who have a disability, people who self-identify as gender diverse, people who are racialized, people who come from marginalized communities don't have the same access to healthcare, to any kind of healthcare services, the same opportunity as everyone else. And so that is where the equity concept comes from.
Yes, and of course we're talking about clinical trials here, and we're talking about health equity in clinical trials because historically and today these underrepresented groups are also underrepresented in clinical trials, correct?
Clinical trials, yeah. So the concept of equity in clinical trials then comes when you talk about um, the participants who are in clinical trials should be those who are most likely to have the condition, who are most likely to need the treatment that the trial is testing, and then will also have access to the treatment after the trial has ended. So equity in clinical trials, equitable access for people in clinical trials means that you have people from diverse backgrounds who are part of clinical trials. That's the key to improving health equity in the context of clinical trials, is to have
Yeah,
diversity.
yeah, and the reason that I kind of said let's circle back around to that about what you were saying before about why somebody would want to participate in clinical trials is all of these benefits should be available to as many people as possible, right?
Absolutely, absolutely. And like you said, there are some groups that are historically underrepresented in clinical trials, globally as well, but certainly here in North America. And given the multicultural sort of landscape that Canada has, it's even more important to leverage those factors. It really presents a golden opportunity for researchers to drive their projects to success, and really make their projects diverse, both in terms of having a workforce that is diverse, but also participation.
Yeah, well, and certainly if like a group of drugs, for example, works differently in different populations because of any number of genetic factors, that's important for people to know.
Absolutely. Absolutely.
Um, we we wanted you to come on because your work at these organizations is sort of helping to address some of these problems. But before we get into like the solutions writ large, would you be able to share maybe some of the reasons why these barriers exist? Like an example of a barrier to accessing clinical trials?
Yeah. So, of course, I'll talk about the new immigrant population because that's the focus of my work. And with a note to say that that also includes refugees and asylum seekers. So, just to step back a little bit and to just put in context why this group is important. The new immigrant population in Canada has increased quite significantly in the last few years. The latest census from Statistics Canada in 2021 showed that there were over 1.3 million new immigrants that had settled in Canada in the last 5 years, which is actually the highest number ever recorded in a Canadian census.
Yeah, and I
And
believe that Canada has the largest proportion of citizens and residents who were born outside of the country.
exactly my next point,
Yeah,
exactly. So it's 23% right now of the Canadian population that has been born outside the country. And Stats Canada actually projects that by 2041, it's going to be 34% and then grow even more from there. So this is a very large group, and we know research has been done on this, and research shows that individuals who are foreign born have a less likelihood of accessing primary and preventative healthcare services than Canadian born counterparts. And you talked about barriers. So what are some of the barriers that they face? It really could be anything ranging from geography, financial constraints. There's the language barrier as well for many. There's cultural differences. So all of these sort of culminate to create this network, this labyrinth of challenges that keeps them from accessing even healthcare services. Immigrants, including refugees and asylum seekers, have unique lived experiences that may sort of predispose them to some really significant physical health and mental health conditions. We know that refugees and asylum seekers are are oftentimes experiencing injury and abuse and trauma. So the pre-migration trauma and then the post-migration stressors really all just kind of add up and culminate into, you know, some serious mental health and physical health challenges that might actually benefit from the specialized attention in clinical trials.
Yeah. I know that you have sort of a personal connection to some of these barriers. Would you be okay to talk maybe a little bit about the story there?
Yeah, absolutely. So, my mom was diagnosed with end-stage metastatic colorectal cancer almost 2 years ago. And our journey was quite riddled with challenges as well. And so, just to kind of step back and give you some context, so my mother was somebody who, person of color, of course, a new immigrant as well, limited English proficiency. But we kind of took our diagnosis. I was there with her. I was her advocate. I was her translator. I was her caregiver. And when she was first diagnosed, we inquired about the possibility of clinical trials because that's what you hear about as well. And being in the field, of course, I was really eager to find out if we had any options that would prolong her life. And at that point in time, we were told that there was nothing in Canada that was available, but maybe in the US, which of course wasn't feasible for us. So we started on the standard of care sort of options, but as the available sort of treatment options were exhausted, we once again then inquired about clinical trials, and we were told there was a glimmer of hope because we were told that there might be a trial opening at one of the downtown cancer centers in Toronto. And so we're really, really excited, thinking like, okay, this is the breakthrough that we needed because we had already exhausted all of the treatment options. And we went there only to find out, heartbreakingly, that we were not eligible because her health had deteriorated too far. So it was kind of a frustrating moment because when she was well enough, she didn't qualify because she was doing fine in a way on the treatment. And then when she needed it, she didn't qualify because now she was too sick. But even if we weren't eligible, it got me to thinking, let's say we were. This cancer center was literally a 1 hour drive away from our house, one way. And if you know the traffic in Toronto, then you know that that can be quite enormous. And so there's that 1 hour drive. There's multiple study visits, multiple assessments, etc., for which we would have to go again and again. And you can't, like, I mean, for us, public transit was not an option. She was too sick. We had to take the car or we had to do rideshare. And that's so costly. So, how many times could we possibly make this happen without just breaking the bank, right? On top of that, there's the time constraint. So, because she had limited English, I would have to be there with her. I would have to be as involved as her because of the translation piece. And so, I was already her caregiver at home. I was already the person who was the driver to appointments and medical things. And then now I would be a co-participant in this trial with her. Um,
And you
and
have a
so
job.
and I have a family and I have a job and I have my own, home and life to manage. So you can imagine how enormous this is. Um, Not to mention, we were just lucky because we lived in Toronto and this center happened to be in Toronto. What if this trial was opening up, but we lived in another province or we lived somewhere really remote? That would be even more, insurmountable, really. So even though this option existed, there were so many layers of complexity to accessing this option that it just becomes insurmountable and then you don't even think of it as an option anymore. So the first thing is just even having the availability of a trial in Canada, that possibility, and then matching up your timing with that. And then over trying to overcome the financial barriers, the time, barriers, the support that a patient would need if they didn't speak English very well. And so all of these things just became really, really insurmountable. And I mean, would a clinical trial have helped give her more time? Maybe, maybe not. But at least in this day and age, living in Canada, that option should have been available to her.
Absolutely. Well, I also just want to say that I am sorry for your loss. And thank you for sharing that experience. I think it really serves to illustrate the, like you said, the sort of multiple layers that
Yeah.
exist. That like a big concept like a barrier to access or barriers to access can seem simple to say, well, solve the barrier, solve this, but these larger
Yeah.
concepts obscure, many smaller steps along the way where it's like, well, if you solve all of these things, then you've solved the barrier to access without necessarily saying, we're going to go lower all the barriers to access, right? It's just kind of
Yeah. Yeah. Yeah.
a
Yeah.
complicated, a complicated world. That being said, however, you are working to solve some of these barriers to access. Do you want to share a little bit about sort of the work that you're doing to make
Yeah.
clinical trials available?
Well, we're trying. It's a long road ahead, but we're trying, one step at a time. The first step we thought in addressing this issue would be to have a conversation with the people involved. So we're talking about the new immigrant population. We were very lucky through my work at N2 that we were awarded a CIHR grant last year to host a community consultation with the new immigrant community to talk about specifically what kinds of challenges and barriers they faced as newcomers to Canada when even accessing or being finding out more information about or participation in clinical trials. And this conversation that we had was held at a public community center so that it was more accessible. It was done in a group setting, and it was a really, really great conversation. We had a lot of really valuable insights that came out of it. And one of the sort of the most common themes stemming from that workshop, from that consultation, first and foremost was about trust. And of course, there's a lot of historic context, with this, where many communities, many individuals from different communities have been exploited in the past, unfortunately, and have been mistreated in the context of healthcare, medicine, but also in the context of research. And we know that we have many examples. And so, because of that, because they have these unique experiences that they've had before they've immigrated here, that perspective also comes with them. And so there's this gap where they don't necessarily have trust. So it kind of started out with, okay, where is it that I will find reliable information about clinical trials to even just to learn about what they are? And it's not necessary that if you point them to a website that they would be willing to go and learn more about it through that website and then trust it. So what they said was that it would be better for them if researchers and scientists and research teams would actually come to them, come to the community centers where they regularly access other services. And these are familiar settings to them, these are trusted settings. And then they would have group sessions like this where they could learn about research and what clinical trials are and what it entails and all of that. Having ambassadors on the research team who looked like them, who they could relate with, who were peers with lived experiences as immigrants, who had perhaps gone through that journey of a clinical trial, who could speak to them. That would be very valuable as well for researchers to have on their team to build that trust and overcome that gap of trust. So trust was a big thing. Um, Secondly, it was about cultural competency. So that includes language as well. That includes cultural sensitivities. I'll give you an example. So there are many cultures where decision making is done in a family unit. So families are extremely strong units and they do everything together and they make decisions together as well. And so I'll even give you my own example. So through our journey with my mom, one time we were approached for a clinical trial that was more of a quality of life study. And we were sitting in the waiting room for our appointment, and we were approached by this research coordinator who came and showed us the consent form. And like I've already mentioned, my mom had, she understood English and she could speak it as well, but not fluently. So she kind of pushed the consent form to me and said, okay, read this and tell me what it is and all that. So I started to, and I started to ask some questions of the research coordinator as well. And it sounded as if she was quite adverse to me participating in this research conversation. She really wanted to hear from my mom, who in her eyes was the patient, was the individual who was going to be autonomous in her consent, and she wanted to talk to her. And while that is great, but in the dynamic that we were working in, I was the person who my mom trusted as her advocate, as her caregiver, as the interpreter in many, many cases. So when my mom kind of saw that I wasn't being allowed to speak or answer questions on her behalf, it turned her off and she didn't want to participate anymore because she felt like this was going to be a place where her daughter is not welcome, her advocate is not welcome, and she would have to manage herself, and she's not wanting to do that. So she stepped back. So these are the kinds of cultural sort of, sensitivities as well as language, inclusive language. How do you kind of manage, that type of dynamic when a family comes to you, as opposed to an individual, and how do you kind of embed them into the circle of research? So,
Yeah, and
among other
providing
things. Yeah.
providing training, but also value, like so that medical practitioners will see other ways of operating and not think that's something I need to fix or that's a problem, but oh, I'm
Yeah.
curious about this. I want to learn this. I want to engage with this.
Yes, yes,
Yeah,
yes, yes.
I will say, well, two things. First is I am so glad that you are here talking to us because I think something that you have such facility with is sort of taking a concept like cultural competency and sharing a story that explains what it really means. I think in these conversations, there's a lot of big terms, and get lost in the terms. But with you, I always find it's here's what it is and here's why it matters. And I think that's so helpful to people listening. But also just to the people listening, I wanted to share that sort of as a result of our working with Munaza, and sort of other EDI initiatives at CCC, we are also sort of engaging in the practice you described of like reaching out to communities and meeting people where they're at. Because for us as an organization, it is a growing priority to make an effort to reach people who we're not reaching yet, who we can benefit and who can benefit from knowing us. So it's really valuable stuff, these ideas. And to anybody listening, if they do need help or need support reaching clinical trials, you can reach out to Colorectal Cancer Canada, go to our website or info@colorectalcancercanada.com, and we are super happy to help put you in touch with all sorts of folks. And I think that was my spiel. Sorry to interrupt um your thought. I guess hearing you talk about all of these things, what are like important next steps for increasing access kind of across the board?
Yeah. So I think we should really pay attention to language sensitivity. So this is a big issue with many new immigrant communities where language is a significant barrier. So if we were to take some time and some money from our budgets and really look at translating some of the materials that we use in clinical trials, in language that is not just translated, but in a culturally sensitive manner. If we start to think about onboarding a diverse workforce, those ethnically matching staff and that linguistic matching staff will really go a long way towards building the trust of participants that come from diverse ethnic communities and language communities. I think that would be, that's something that we could try to do even today. Long term, I think cultural sensitivity and cultural competence training is an absolute must for anybody who is doing clinical trials in any way, shape, or form, especially the individuals that are interacting with the public in the front lines of clinical operations. And you mentioned at the outset that I've recently authored a course on cultural competency skills, and that is available free to all of the N2 membership, which is quite large across the board. And so this is something that, ideally when people take the course would really give them some really important insights into what that looks like in your day-to-day interactions within your environment. So some really important examples as well, and some case studies and scenarios to work through so that, like you said, that it all doesn't just remain very theoretical, but it can now be applied into practical sort of scenarios. So that's really important. And then I would really advocate for the continued conversation. So, like you said, Colorectal Cancer Canada has been making a very conscious effort to reach out to communities, to meet them where they are, to not just hear about what it is that challenges them, but also to provide some co-create some solutions with them. And then most importantly, share back, whatever it is that you have done, make that available to the community as well, and share your learnings and close that loop, and so that there is this sustainable relationship with communities, and that you're not just going in, researchers are not just going in when they need something, they take what they want from that community and then they move on and they publish the results and then they've gone away, and the community is left wondering, well, you came in once, what happened? So
Yeah,
building these
a kind of
relationships.
colonial practice almost.
Yeah, yeah. So building sustainable relationships between researchers and communities is really important.
Absolutely. And something that strikes me just sort of in this conversation is that these things are of benefit to everyone, making more languages available, increasing cultural competency, having more people participating in clinical trials, getting better data, getting more people better care. These are things that are baseline simply good for everyone, regardless of
Yeah,
what community they're in. And I think that is also worth highlighting, that
yeah.
the push for equity is of benefit to all.
Yeah,
Um,
absolutely. It is. It is. And going back to one of the points that we made at the outset in terms of um what it means in clinical trials, what this concept means in clinical trials, when you have a diverse population participating in your clinical trials, you're going to be able to reach that many people to benefit from the treatments, that the trial is testing. So they're going to have that condition, they're going to need the treatment, and then they're going to have access to that treatment. That's equity in clinical trials. So ultimately, your project is going to be stronger and your results are going to be stronger.
yeah, and the health of the country will be stronger.
Will be better.
Um,
Exactly.
yeah. Before I let you go, I just want to ask if there's anything that you think we missed or that you think is really important for people to know that we didn't have a chance to talk about.
No, I think we've covered the topic well, and I don't, of course, there's a lot of work to be done in the future on this, and we'll continue to push forward. But I think just to even recognize that this is something that we absolutely need to address, and to address it now is key.
Yes. Well, thank you so much for joining us here today. This has been Munaza Jamil. I have been Carl Bindman at Colorectal Cancer Canada. Before we go, just to those watching, to those listening, if you want to learn more about Munaza's work, Munaza, where can people find your work?
Yeah, so if you go to the N2 Canada website, which is n2canada.ca, you can go into the Public Engagement Committee tab and you'll see a bunch of resources that we've uploaded, which includes the white paper that has all of the results and the insights that we had from our community consultation. And there's a couple of other toolkits and things like that as well.
Wonderful. And if anybody listening or watching this wants support or information around colorectal cancer for themselves, for a loved one, for somebody that they're taking care of, please reach out to us. We're happy to help you. And if you want access to clinical trials, that's something that we do is we help connect people with clinical trials that might be appropriate for their treatment. So contact us at info@colorectalcancercanada.com or support at colorectalcancercanada.com or go to our website. You guessed it, colorectalcancercanada.com. And our social media, which is at colon Canada on most platforms. So thank you again, Munaza, for joining us. Thank you for listening, and we'll catch you next time.
Thank you.